It's Wednesday, April 8th, and time for your Barbados Today morning news update. Prepare for more difficult times ahead. The dire warning from the director of the Pan American Health Organization, Dr. Lucia, who said the region should expect a surge in COVID-19 cases and deaths over the next 3 to 6 weeks. Speaking at a virtual press briefing yesterday, the PAHO director warned that the pandemic was accelerating rapidly, and she urged governments to prepare and respond at the same speed.
My friends, the days ahead will be some of the hardest of our professional lives. We face a pandemic that is spreading faster than any of us could have imagined. And it is going to test our systems and our capacity more than they've ever been tested before. We are counting on you, on your ability to thrive under pressure, to respond to challenges, and to fulfill your commitment to the people that we serve. We cannot overcome this pandemic without your courage and dedication. Please take care of yourselves, seek support, and speak up when you need help and resources. From PAHO, we will work tirelessly to give you the support you need in the time of crisis.
Dr. Etienne said the situation would get worse before it gets better and called on the region to prepare.
Forecasting is difficult. It's difficult in a situation that every country has its unique set of factors, and our region has many factors that are different from the factors that are present in Asia and in Europe. However, within the assessments that we've been able and analysis that we've been able to make, we do believe that in the next months or so, 3 to 6 weeks, that many of our countries will begin to see an increase in their number of cases. There are some of our countries that will probably experience an overwhelming of their health systems, and we would probably also see increased number of deaths. Of course, all of this depends on how well our member states execute the social distancing. If they are going to continue with social distancing methodologies, whether we have sufficient workers, whether we have sufficient beds, particularly ICU beds.
Meantime, PAHO's Director of Health Emergencies, Dr. Ciro Ungate, lauded the efforts of Barbadian authorities for building the country's capacity to adequately deal with the COVID-19 pandemic and assist other countries.
Barbados have been establishing and strengthening their capacity to help other countries. Barbados has established the emergency medical team, and it is something that we'll look at to strengthen in terms of having that capacity also at the service of other countries in the Caribbean. And I think that is a good approach, but also it shows the solidarity that the Caribbean has always shown to the region. As a matter of fact, the emergency regional team that is well established in the Americas, which has most participants from the member states, were established first in the Caribbean. So we're looking for the Caribbean for this epidemic, but also we have to highlight that those countries also face several challenges, particularly in the access to personal protective equipment, on tests.
Barbadians will find out within the next few days whether they will remain under lockdown. Acting Prime Minister Santia Bradshaw disclosed that government would soon be meeting with other stakeholders to determine the next step forward as the country battles the COVID-19 pandemic. Speaking during a press conference yesterday, Bradshaw explained that while officials are constantly reviewing the 24-hour curfew, which came into effect last Friday, government would ultimately be guided by the health experts on whether it would be relaxed, lifted, or extended.
We're reviewing every day I keep repeating, the dynamics continue to change. The figures continue to change. We are still on track in terms of what would have been predicted in terms of where we would be. But again, we are guided by the medical health professionals in terms of changing the dynamics of the curfew at this stage. And I believe early next week we will make the announcement in relation to whether that advice is said to us that we continue or whether we relax the curfew in any way. But I just to assure you that we've had the preliminary discussions with the private sector and our various partners and stakeholders with a view to looking at other mechanisms that may have to be put in place if we have to extend, because we're not waiting until that advice comes. We've been looking at all of the other countries across the world, the other islands in the Caribbean, to look at how they've been handling it, to look at how their people have responded to a number of the measures, and also looking at what Barbadians can handle at this stage. But all of that is balanced first and foremost by public health concerns.
COVID-19 czar Richard Carter, who had previously voiced his displeasure at the actions of Barbadians during the first curfew, admitted there was a possibility the 24-hour curfew could be extended.
The date of expiration of the curfew remains as has been announced. I believe it is midnight on the 14th of April. However, we have said consistently that if the situation warrants it, there is provision for a further extension. Obviously, that is something that we hope we will not have to do. We understand that the restrictions have been uncomfortable for many Barbadians. We understand that it has caused dislocation, as the Prime Minister said, but we will only make the adjustment to the date, the current date, or make an extension if the situation warrants it. That is currently and continually being evaluated by the Health Emergency Operations Center, from which the government of Barbados has continued to take its guidance and direction. Those are the public health professionals. Those are the ones who are best placed to determine whether or not what we are seeing in terms of the presentation of cases is consistent with what we expect at the end of the day.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region now, health officials in St. Lucia refute claims that the country had recorded its first COVID-19 related death. We get more in this report from HTS News Force.
Chief Medical Officer Dr. Sharon Belmont George sought to dispel rumors about the virus during a Sunday night address to the nation. It was her second attempt at clearing the air. While no one in St. Lucia had perished from the disease on the weekend, there was one new confirmed case.
We have a total of 14 COVID-19 cases, confirmed cases in St. Lucia. And to date, all of our patients are clinically stable. None of them have complicated, and we have no deaths. We have 0 deaths of COVID-19.
The Health Ministry commenced testing for the coronavirus disease 2019 around the last week in March, but the lab has since run into a few snags with sourcing material.
We have developed national capacity to test for COVID-19 at the Ezra Long Laboratory at the OKEU Hospital. Globally, there is a shortage of the reagent, and St. Lucia, just as all of the other islands in the region, we are faced with the increased time of receiving those reagents.
And finally, the months-long lockdown in the city of Wuhan, China, where the coronavirus pandemic started, has been lifted. Train, road, and rail connections have now been re-established as persons leave their homes for the first time since January 23rd. It comes after China reported no deaths on Tuesday, the first time since it began publishing figures. We get more in this report from the CNN.
The restrictions easing for outbound travel out of Wuhan, and we know that as of about 5 hours ago, crowds of people were already doing so, getting on trains, planning to fly out or get on the highway and finally be able to leave after 76 days. I need to point out, though, within the city of Wuhan, for folks who are staying, restrictions are still in place. Those are enforced by, for example, your local community officials. That would be like your HOA or your condo association, enforcing the quarantine, monitoring people going in and out, and still limiting many people to about 2 hours a day, one person per family, to go out and then go back into their homes. And the other reality is people are still hesitant, if not terrified, Jake, because quite frankly, they're still skeptical about the numbers being so positive. They wonder if it's too good to be true.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.